Well, this week is Black Maternal Health Week, highlighting the risks that black mothers in America face during pregnancy. A new report from the CDC found that in 2021, the maternal death rate was nearly 70 per 100,000, and that's more than 2.5 times higher than it is for white women.
Well, going deeper now, almost 30% of Colorado's black pregnant women on Medicaid didn't go to a doctor's appointment during their first trimester. It's according to the latest analysis by CDPHE. Denver 7's Micah Smith is digging into a program looking to improve maternal care and health equity.
And she met with a group of doulas working to help black moms one deep breath at a time.
In 2023, Colorado's maternal death rate is rising, and black mothers are most at risk.
I've been doing midwifery work for almost 20 years, and I think the past 5 years is the first time that I've heard from a black pregnant person say they were scared to die.
The latest statistics show black mothers are 3 times more likely to die during birth. And CU Anschutz, director of midwifery, Jessica Anderson, says there are several contributing factors.
We know that our systems are really have racism that exists, implicit bias. Care looks different in certain areas of our communities, meaning people don't have access.
Anderson says some of her patients are taking matters into their own hands, turning to doulas, trained professionals who help with physical and emotional needs.
My personal reason for getting a doula is to help navigate a very racist healthcare system.
Just having a doula present greatly changes how a birth outcome would be, that positive birth experience.
We visited Mama Bird, a maternity wellness spa in Aurora, where we talked to this group of doulas and new moms.
My first pregnancy was during COVID, when everybody was paranoid about everything in regards to going to the hospital. I had my doula in my first experience, so it was life-changing care.
But there are still barriers to having the support of a doula.
I think it's also partly affordability. We don't live in a society that offers universal, free, quality health care.
A lot of people don't know what a doula does. They look at it like a luxury as opposed to a necessity, and that's not what it is.
As the co-deputy director at Elephant Circle, we actually do a full wraparound, kind of like a full wraparound services from legal douling to supporting birth workers.
Mama Bird also offers help.
On our nonprofit side, we have partnered with Colorado Access to provide at least 40 black families with full spectrum doula support.
These women say for years they thought they had very little say on how they could bring their children into this world.
Ultimately, I think the part of our advocacy is teaching them how to advocate for themselves.
With the help of their doulas, they feel empowered to make some of the most important decisions of their lives. Reporting in Aurora, Micah Smith, Denver 7.
And going in depth now, maternal death rates are up for women of all races. We know not everyone can afford a professional doula out of pocket, so I looked into what options are available. Rocky Mountain Doulas says doulas can provide an NPI number, which you can use to consult with your insurance provider. They say the number of insurers reimbursing costs is small but growing. Another option, paying through your health savings account to lower your costs on a pre-tax basis. And RMD says doula fees in Denver range from $700 to more than $1,800, and they recommend recently trained doulas for more flexible fees. You can get connected with one by filling out a form on RockyMountainDoula.com, and doulas will then contact you directly.